what other industries or guidelines in industries or sectors of community uh, are you going to uh, expect some impact from if they are loosened?
Uh, I think Lucci, that's already been. I mean, we haven't seen this yet, but there are already studies. I think Texas Medical Association is one of them that certain activities which are parang connected to mass gatherings. These are usually the highest risk of activity. So this would include concerts, and so when you mentioned yung mga film, I would be a bit worried about that. So something that involves a lot of people. I mean, for example, a gym may not involve so many people, but a concert or a movie house,
Church.
a
Math.
church, a
Yeah.
mass with a lot of people. Those would be risky activities based on studies already done outside the country. So those would be something that we should be very cautious about. And yung nangyari sa public transportation, that was in a way enabling congestion and we're enabling crowded places in a public transportation, and that as we have already mentioned in a previous interview with I think Father Nick mentioned that by decreasing social distancing, you're also crowding your buses and your trains. So and that could lead to more transmission.
Well, what about this debate now over whether to allow face shields in factories and in workplaces where, you know, good vision is necessary for actually undertaking any kind of activity? They were talking about like in factories that deal with very, very small parts or construction, for example. It's going to be very hard for construction workers to be putting on a mask and a face shield while, hammering away or doing their thing. What about those kinds of activities? Do you think they're going to have an impact on the numbers?
Actually,
Okay.
I haven't seen any construction workers.
Actually,
Yeah,
debate
hold on.
pinag-aawahan
I'll let
Yeah.
Professor Ranjit handle this one, but I haven't seen any construction workers wearing face shields actually.
Medyo mainit.
Actually, that's the problem. I haven't seen myself. I haven't seen myself, but in Taguig, it's well documented. A construction site became an epicenter for community transmission, and it really, that's a perfect example of a enclosed or crowded space, and it's really up to our health experts and government to set guidelines for this, no? And it's actually a major issue with the private sector. Up to what level should they provide, no, to ensure safe workplaces? And the government will set the guidelines, but the compliance will be with the private sector. And when you look at our data, past and present data, you'll see that the greater number of people who are getting sick are from the working population. So there are two places where people get sick, no? They get sick because they go to certain workplaces, and they get sick in their own communities, in their own homes. So this is we're seeing good numbers, but we're not seeing numbers that should convince us, that would convince at least our team that we should loosen, significantly our restrictions. And so that's why I was saying earlier, I think if there are some industries that we need to be very careful about opening or providing stricter guidelines, transportation will be one, second be tourism. So we need to really work on these things. No? The other industries that are going to open or expand are not so much of a problem for me, apart from safe workplaces, offices, and factories, and of course, transportation and tourism. These are the key areas which I feel will create more vectors for transmission. Imagine we're going to open up provincial bus operations. No, that has to be monitored very closely because we might, there's still a lot of cases. Yes, we have gone down significantly over the last month or so, but the caseload is still high. The virus is still here, and if we're not careful, we might be transporting carriers all over the country through provincial bus lines.